Hi friends, so today we'll see the previous year questions or the important question from the chapter CVS Cardiovascular System. So let's get started. So first long essay for 10 mark. First question, describe the mechanism involved in long-term regulation of the blood pressure. Add a note on hypertension. So blood pressure is very important in CVS. What is blood pressure? Definition, normal value, all the regulation also very important. So here they particularly ask for long-term regulation. They may just ask regulation of blood pressure. So you have to write all regulation in that question. Here they asked to write a note on hypertension also. So that is also important. So this hypertension question you may get for case-based question also. So it's very important. Next, define arterial blood pressure. Describe the mechanism regulating blood pressure. So as I told, you have to study the definition, normal value. Here they just asked regulation of blood pressure. So you have to write all three term, long term, intermediate and short term regulation of blood pressure. So this plus one, it indicates how many times this question is asked in previous paper. Okay, so this is very important. Third question, define cardiac cycle, describe various phases of cardiac cycle, add a note on volume and pressure changes that occur during cardiac cycle. Again, important question, definition of cardiac cycle, what are the phases or stages of cardiac cycle. Here better you should draw a diagram or you should draw a flow chart and write all the phases with duration. Then add a note on volume pressure changes. That is again important question. So here they directly asked pressure volume changes. They may ask Weber's diagram. So Weber's diagram is nothing but the same graph. Okay, so if you get Weber's diagram in question, don't get confused. That is nothing but volume pressure changes also. They may ask pressure changes occurring in left ventricle. That is also same. Predominantly pressure volume changes will be there in left ventricle. That is why we are getting the question like this. Now, define cardiac output, cardiac index, describe the various factors regulating cardiac output. Cardiac output is also very important. You should not miss it. The definition, a normal value, factors regulating cardiac output, and how to measure the cardiac output also you should study. Then describe the conducting system of the heart, describe the origin and spread of cardiac impulse through the heart. So here better you draw a neat diagram of the heart and mark all the points like what is SA node, AV node, bundle of His, Purkinje fibers, everything. And for origin and spread of cardiac impulse, better to draw a neat flow chart and explain it. Okay. Then define cardiac output, cardiac index, ejection fraction. Mention the method of determination of cardiac output and describe any one method in detail. Here again they ask for cardiac output, index and ejection fraction. So you should know the definition of all three, the normal values. Particularly here they asked method of determination of cardiac output. So for a safety, better study the names of all the method for cardiac output and study any one method in detail. Okay. Then 8th question, last question, enumerate type of shock and describe neurogenic shock. Shock is also should not miss definition of shock, types of shock, and all shock you should study in detail. So in previous question, neurogenic shock and hypovolemic shock, they have repeatedly asked. So don't miss about shock. The next is reasoning questions or short notes for 3 or 5 marks. First one is electrocardiogram or ECG, and that is very important. 3 times it asked on the previous question. So here you should know how to draw a normal ECG. You should mark all the points, intervals, segments, and better to write the significance of intervals and segments. Then PR interval, again it is very important. It asked 4 times in previous question paper. You should know what is PR interval, how to draw it, what is the clinical significance of PR interval. Then jugular venous pulse or JVP. You should draw the JVP graph here, mark all the points and importance of jugular venous pulse. Then heart sound, that is very important. You should know everything about all 4 heart sounds, how it is producing, what is the reason behind it, all that things. Then venous return, what is venous return and the factors affecting venous return. Then hypertension. So hypertension question you may get in case-based question also. Then baroreceptors mechanism for regulating blood pressure. All regulation you should know. and all the subheadings under that also you should write here. Then hypovolemic shock, then pacemaker potential. So this is important. You should draw the graph of pacemaker potential, how it is generating, what is ionic basis of this potential, you should know. Again, it is asked here, ionic basis of ventricular action potential. Then pacemaker of the heart. So here you should know about SA node, where exactly it is present, how the impulses are generating from the pacemaker, all that. Then conducting system of heart, better to draw a flow chart and explain under that. Then effect of moderate exercise on CVS. For safety, it is better to study all type of exercises, mild, moderate and severe exercise effect on CVS. Then arrhythmia and heart block, you will get it for case based question also. Then myocardial infarction, again case based question you will get. Then circle of Willis. So in MI you should know the pathophysiology of myocardial infarction, the symptoms, pathophysiology, how it is happening, the treatment, everything. Then circle of Willis, you should know how to draw a proper diagram. You should not miss to write the special features of the circle of Willis. Now for short answers, 3 mark, you may get coronary circulation. What are the special features of coronary circulation? You should know. Then Frank-Starling's law of heart. Then volumes of cardiac cycle. So here again the diagram only. Then autonomic effect on cardiac activity, sympathetic and parasympathetic activity, how it is influencing the cardiac activity. Then QT interval, again what are the clinical significance. Then the cardiac output, the definition, normal value, factors and all. Then sinus arrhythmia. Then the AV nodal delay. This is again very important question. So you should know what is AV nodal delay, what is the normal delay, normal value, and you should particularly know what is the cause of AV nodal delay or what is the physiological importance of this AV nodal delay. Then arterial pulse tracing, then the cardiac index, the normal value, then wave of ECG and waves of JVP. Then at last, refractory period in cardiac muscle. This is also very important. So here they directly asked, you may get question like, why the cardiac muscle is not getting fatigue? Okay, so that is also because of the long refractory period. So you should know that. So these are the important previous questions that is repeatedly asked during past years. So if you're studying all these questions, you will definitely going to pass this. Okay, I think you will get above average mark in this CVS topics. Thank you.